I talk a lot about menopause and perimenopause and functional medicine, but today we're going to talk a little bit about PCOS, polycystic ovarian syndrome, and how we can approach that from a functional medicine standpoint. PCOS is becoming much more common. Many more people struggle with it. And really what's happening in traditional medicine is they're just getting put on birth control pills, spironolactone, and metformin to kind of control the symptoms. But from a functional medicine perspective, there's a lot more that we can do, including things like targeted diet and targeted exercise, the right kind of exercise for this set of symptoms and the situation, and really make the patient both feel better, look better, and even restore or protect fertility. Now, PCOS is not just cysts on the ovaries. If only it were that simple. PCOS includes symptoms like hair loss on the head and hair growth in certain places, sort of more masculine places, like the kind of chin line here, excess weight. It includes insulin resistance, all sorts of things that are troubling, and especially when it comes up often in the teen years, early 20s. This is troubling, right? Especially when it comes up in the early 20s. Fertility is a huge concern, and so we want to make sure we do everything we can to restore balance and restore optimal health, and not necessarily with prescription drugs. So when we think about the root causes of PCOS, there's many potential. And one of them is insulin resistance. And whether that comes because somebody is overweight or that happens after they're overweight, maybe we don't quite know. But insulin resistance is definitely a piece of PCOS. And then what happens is that insulin is inflammatory and it leads to increased androgens, remember, which is what causes that hair loss up here and the hair gain up here and even the acne. And so we want to get to what is the root cause of that and then treating that. So a low glycemic diet, sometimes for some people maybe a ketogenic diet, although that's pretty extreme and I often don't use that. What I do use is something similar to a paleo diet where we're avoiding grains, we're avoiding dairy, we are eating complex carbs that are not going to spike the blood sugar. And then in terms of exercise, I very rarely recommend true high-intensity interval training with longer intervals. However, with PCOS, high-intensity interval training for short bursts is really important for battling the insulin resistance. We talked a little bit about inflammation being a part of PCOS, and that's very pertinent. Does that come from the gut? Is there gut dysbiosis? Are there food sensitivities? Are they inflamed because they're carrying extra weight because the insulin is so high because you're insulin resistant? You have a lot of different things to suss out there, and one of the advantages of working with a provider, a licensed provider who's able to order testing, is you can figure out some of these root causes a lot more easily by testing than just by treating and guessing. So we can figure out what is going on in that gut with a stool test, and see what do we need to treat and what don't we need to treat, because we don't want to waste time treating things that aren't going to help. Stress and sleep are huge, not only for people with PCOS, but for everybody. Now, especially for women with PCOS, sleep really helps blood sugar regulation, for example, the next day. Stress really impacts insulin resistance, blood sugar regulation. So figuring out how to get your body to sleep well, whether that's improving sleep hygiene, or maybe it's a little fancier than that. Maybe, you get a vagal nerve stimulator to wear that helps you calm down for sleep. Maybe it's just making sure your bedroom is extra dark and extra cool as much as you can. We have the 8 Sleep mattress cover that we use to kind of cool down our bed overnight so that we sleep better. So stress and sleep are 2 huge pieces of root cause treatment for polycystic ovarian syndrome that are often missed in traditional medicine. With PCOS, we often ask, why did this start? It's so frustrating. And there is definitely a genetic component to this. And I think that's important to mention because oftentimes women with PCOS have not done something wrong that's caused them to get PCOS. This can be very genetic. Now, it can be managed and better in some people than others, depending on their lifestyle and even environmental exposures to plastics, to vaccines, to processed foods and fats and chemicals in the foods and glyphosate. So lots of different factors there, but there definitely is a genetic piece to PCOS. So I'd like to talk about 3 sort of pillars of PCOS treatment. And the one is we need to stabilize the metabolism and reverse the insulin resistance. And really, how do we do that? We want to focus on blood sugar regulation. I already talked about diet and eating higher complex carbs that are not going to spike the blood sugar. The next thing is physical activity, weightlifting, so building muscle, and then some high intensity interval training. Not craziness, not, high intensity intervals for an hour and a half, but maybe it's 20 minutes of exercise where you're going all out for 30 seconds and then recovering for 3 minutes. All out for 30 seconds, recovering for 3 minutes, and do that for 20 minutes or so. And that should be sufficient. Weight management, of course, and that comes along with the diet piece and the exercise piece. This is going to be harder for women with PCOS to lose fat just because of the insulin resistance. But we do want to make sure that we are respectful of body image and talk about it in a healthy way, while also understanding that a body that is carrying extra fat is not as healthy as a body that is not. Fat is it's inflammatory and produces insulin resistance, aggravates that. So we do want to aim towards a healthy fat percentage in the body. A few other organ systems, so to speak, to look at would be the thyroid and make sure that's balanced so that things like metabolism, we're not working against ourselves if the thyroid is slowed. Definitely want to work on gut health and liver detoxification. The liver is what kind of processes and metabolizes a lot of the hormones that we have. Even looking at genetics, and is there a genetic predisposition to slower processing or abnormal processing of the hormones? That would be really important as well. And then again, sleep, stress, circadian rhythms, going to bed at the same time every night, waking up at the same time every morning, even on the weekends. I'm sorry, I know, but it's just better for your body if you can do that. With PCOS, it's important to understand that this is a journey. This is not a condition that we treat once and we cure and it's gone. If you've had PCOS, you're likely to always have the propensity towards PCOS, even if you're eating perfectly and we've cleaned up everything, we've healed the gut and the thyroid and the adrenals are on track. If there's the genetic predisposition there, that's going to remain. So knowing that this is a journey and not a cure, we want to keep in mind a few things. Continuing to measure lab markers, like especially the androgens, but also fasting insulin level. Other hormones, progesterone can be low sometimes in PCOS, and testosterone and DHEA high. So keeping in mind that we want to balance those appropriately, whether that's with diet and some herbals or with, sometimes I'll have to replace progesterone in women, especially as they get towards the perimenopausal age. And that's fine. We want to do what we can to help women with PCOS thrive. And then one of the advantages of Nourish is that we have regular check-ins with our patients. We include a certain amount of visits and IVs with our patients as treatment, of course, and discussing the treatment plan, but also as just a way to check in and make sure everything is progressing well and there are no questions. So I'd like to tell you about one patient in particular who I'm thinking about who has PCOS, but she's doing really well. As a college student, she's about 20, 21 years old, came to me for suspected hormone imbalance. Her periods were super irregular, quite heavy at times, but very unpredictable. And as a 20-year-old, that is just, she's in college, and what a pain. You don't know when your period's coming. Definitely had issues with weight and kind of had struggled with that for some time. And sort of no matter what she did, she really was not losing weight. So a few things we did for her, set up an exercise plan, weightlifting, and then that 20-minute period of interval training with the 3 minutes off, 20 seconds on, and, stressed the body appropriately, but not too much. I did start her on Ozempic, a very low dose. When I start anybody on Ozempic, I always start very, very low, and we can increase slowly. My patients are not the ones who are vomiting and not eating food during the day and looking, like Ozempic face. And that's why they do well. And that's why my patients generally are not losing muscle mass, but they are losing fat. So slow and steady wins the race there, and that's what we're aiming for. So over the course of 4 months, this patient lost 40 pounds and feels so much better, and of course is super proud of herself. She's eating much better. So protein and produce is the simplest way that I can explain to my patients how to eat, and we can go a little bit more in depth from there. But she was doing really well with the exercise, with the diet piece of it. Even though she's in college, it was a little bit of a struggle, but we figured out ways to have her prioritize the protein and the produce to get that in. And then even things like sleep in college, it's super hard to prioritize that. So she's doing a great job there. She feels so much better. Even joints hurt less. Periods have started to get more regular. Again, this is a journey, not a we've reached the destination, but she's doing so much better and feels so much better. And actually even her self-confidence and her sense of accomplishment was so neat to see here. One thing to remember too is it's important to avoid extremes. I don't want people necessarily going on the ketogenic diet and staying on that for a long time. What I try and do with my nutrition advice is let's figure out what's doable and sustainable and healthy, because really what I don't want is for this to be a 6-week diet plan that you forget about after the 6 weeks is done. I really want this to be, how can you eat long term? So if you've been diagnosed with PCOS and you're not finding the help that you know you need in the traditional medical system, I'd love to hear from you. We can schedule a free discovery call. I'll chat with you for 15 minutes, see what's going on, and then just make sure that we're a good fit. You're a good fit for my practice, and I'm a good fit for you from your perspective. So you can book that on our website, nourishhousecalls.com, and I look forward to speaking with you.